This is maybe this is my favorite question of our interview, because we need to talk more about the side effects of what we do. We talk in terms of the survival, in terms of the prognosis, but all of the treatments that we do affect patients in many different ways. And so I look at it as a very sort of continuous longitudinal discussion where I talk with my patients about the side effects of surgery. The side effects could include things like scarring, could include things like pain, short term and maybe consequences later on. You could have some long-term pain, and ways to begin to work on those things through physical therapy. And we incorporate the physical therapist early now so that we can prevent post-op pain and scar retraction, so that women can lift their arms and move their shoulders. And it's a really important part of the dialogue. When we talk about radiation, many times people understand that radiation can cause some skin changes and some darkening, but it can also cause some retraction and some pain along the muscle and shooting pains. And so we look at ways to reduce the toxicity of radiation, whether it's by laying the patient on their stomach and doing the radiation from underneath, or by incorporating physical therapist early, by having patients hold their breath. And so there's ways that we're trying to reduce the toxicities of things like radiation. And fatigue is a big part of the conversation that we need to be having with patients. Chemotherapy, of course, targets the fastest growing cells. That means hair loss, it means GI issues, it means anemia. And so all of these things they come with side effects as well. So we spend a lot of time talking about, how to improve those side effects so that you can have a good quality of life. And many of my patients are working during their chemotherapy. They're able to take their children to the zoo and other places. They're able to participate in their normal activities, but they have to make time for rest because the medicines will make you feel a little bit nauseous sometimes. Usually not a lot of vomiting, but sometimes some nausea, sometimes some chills, for anyone who's had flu or COVID. Those types of feelings are now what chemotherapy is beginning to sort of feel like as a side effect. So when people know what to expect, they can anticipate it and they can get through it. But it's the fear of not knowing what to expect that creates a lot of reluctance to even go for these aggressive therapies. So we have to be really upfront with patients about the fact that there will be side effects, but they're manageable side effects, and we can manage them as a multidisciplinary team. We can manage them with diet and rest and use all of the modalities together to help get through treatment.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.